So what I'm going to talk to you, a lot of you already seen this data of programs that we have done throughout the year, okay? So I'm going to focus on one of these research areas, which is looking at pre-calving supplementation of cows. We know for years that the body condition score of this cow at the time of calving is really important for their reproductive performance, right? The greater the body condition score, the greater is the pregnancy rates in the next breeding season. And also the greater the condition score at the time of calving, the earlier those cows will ovulate and they will be able to conceive. But now lately there has been a lot of attention on how we feed these cows during gestation, looking at how it's going to impact the performance of the calf in the future. Right, there's several researches that were done in other parts of the United States, like Midwest or North United States, using Angus cows, that when they provided supplementation before calving, they were actually able to improve weaning weights, carcass quality, and the health of the calves. And unfortunately, none of that data was developed here. So 3 years ago, we started a series of studies looking at what does that strategy work here in Florida for us, right? Thinking of a cow that weans their calf in July and is going to calve around November. So the first study that I'm going to show you to, actually the only one because we don't have time, is a very simple design, and I'll walk through very slowly with you, okay? So very simple design. We divided those cows in 3 groups. One of the groups did not receive any supplementation before calving, which is what we normally do, what most people do, okay? And then a second group, we provided 2.25 pounds of dry distillers grains, a lot of energy and a lot of protein. So it's about 190 pounds of supplement for that cow just during the pre-calving period, right? The last 12 weeks before that cow calved. And then we decided to add a third group, trying to be more cost effective. So instead of providing 2.25 pounds for 12 weeks, we offered 4.5 for 6 weeks, right? The idea is that with the same amount of supplement that I'm investing in those cows, I'm also reducing labor by half, okay? And I'm also providing right after weaning when their requirements are the lowest. So with the same amount of supplementation, I would make them gain more weight, more condition, calve better, and also I'm reducing labor by half. And then we wanted to look at the impact on the mother and the calves. After calving, everybody was fed exactly the same as you would during the winter time, right? They got hay and they got molasses with urea for the whole winter season. So what I want you to look at, if you have your book, if you don't share with your somebody next to you, look at page 37, right? Figure 1 on page 37. That figure shows the body condition score of those cows throughout the entire study, and that's the average of 2 years of study. So the green line are the ones that were supplemented for only 6 weeks before calving. The orange line is the ones that were supplemented for 12 weeks before calving. And the blue line are the ones that did not receive any supplementation before calving, okay? So we started in August. Now look in November, at the time that all of them started calving. The ones that did receive supplementation, they were almost 1 unit higher compared to the control. And the best results were on the ones that were supplemented for only 6 weeks. So it worked, right? With the same amount of supplementation, I had the best results on their mothers. They calved the best condition of all treatments. So if you have to choose one of those strategies, which one would you choose? This one that I'm reducing labor by half and I'm still getting the best results. Now look at the blue line more closely. Look from September to November. Did you realize that they're losing some condition? They lost about 1/4 of body condition score. That's not a problem for their reproductive performance. It doesn't hurt enough their reproductive performance. But we do have indication in other breeds, in other locations, that it does impact the health of the calf after born. So I'm going to show you later if that's the case or not. Now, after calving, everybody was managed exactly the same, and we don't see any differences on their body condition score change after that. But look at the pregnancy rates on table 1 at the bottom of that page, right? No differences among treatments. So I told you right at the beginning that when you increase body condition score at calving, you expect to increase pregnancy rates in the next breeding season. But so what did happen here? Now the reason that we did not see any difference is because look at the control again, look at the blue line. Even though they lost condition, they calved and a body condition score slightly above 5, which is what we usually recommend people to do. And after calving, they did not lose more than 1/2 of a point, which is exactly what we ask people to do. you have to make sure that they calve in a minimum of 5 and not lose more than a half. So those cows, they did not need the supplementation before calving. So it's not surprising that when I spent that money, we didn't see any increase in pregnancy rates. When I saw these results, I was kind of upset because I wanted to show people what you could do. But I'm going to show you at the end of this presentation that it was actually a good thing that this didn't happen. There are 2 ways that you're going to pay for this extra cost of pre-calving supplementation. The first one is increasing the pregnancy rates of the cows and weaning heavier calves, all right? And I already showed you that one of those 2 strategies didn't work. We didn't increase the pregnancy rates. Now, what about what happened to the calves? Look on table 1 again and look for the second line that shows calf birth weights. One of the concerns that people have with supplementing cows during the pre-calving season is that the calves are going to get too big and you're going to have problems with calving difficulty. Well, in our case, we did increase the birth weights of those calves by 2 to 3 pounds at the time of calving, okay? But that did not change the percentage of calves that were born live or calving difficulty. So even though they were bigger, that was not a problem for us, and this is 2 years and it's more than 100 cows in that study, right? And we have other 5 studies that have been done looking at those strategies, and we have not seen any problem yet with pre-calving supplementation. I'm not saying that it doesn't occur, I'm just saying that for us, with the level of supplementations that we have provided, it has not been a problem so far, right? Now, look on the following page, actually page 39, right? Figure 3 on page 39. This is the actual weaning weights of those growth of those calves during the pre-weaning phase. Now looking on day 346, right, that the last date on those calves. That's when we weaned those calves at 9 months of age. And look at the differences on their weaning weights. The calves that were born from cows that received supplementation, they were heavier than the control group. And the best results were when they were supplemented for the entire late gestation. What does that tell you? They were 30 pounds heavier than the control. That the best strategy for the mother, which was supplemented for 6 weeks and having the best condition score, was not the best strategy for the calf, right? So by trying to save a little bit on labor for the mothers, we did not harvest 30 pounds of extra weaning weights on those cows. So now let's look at the economics. Does it gonna pay off or not? Now look on table 2. That's the economics. This is a scenario for someone investing in pre-calving supplementation and selling those calves at the time of weaning, right? And this is the cost relative to the control. How much extra cost you're gonna have compared to not doing anything before calving. So when you look at the cows that were supplemented for 12 weeks, labor was about $5 per cow. When I supplement for 6 weeks, the green group, we decreased that to $250, right? We decreased labor by half. The amount of feed that we provided for both treatments were the same. So the cost of feed is exactly the same, right? So your supplementation cost total, which is labor plus feed, was just $250 cheaper when I concentrate all of that supplementation for just 6 weeks instead of the entire late gestation. Now look at the extra weaning weights of those calves and look at the extra income that you're gonna have. Even though we had no differences on pregnancy rates, when I supplemented those cows for the entire late gestation, those cows, they made $12 more per calf when I supplemented for the entire late gestation. And if I had decided to supplement for just 6 weeks, I'm actually losing $7 per animal. So by trying to save $250, I lost $7 at the end, even though the calves were heavier. But if I supplemented for the entire period, even though I had no differences on pregnancy rates, I still was able to get a small return, but it's still positive return. Now, if your cows are calving in a thinner condition than what I'm showing you right now, it's very likely that you would see differences on pregnancy rates, and then the extra income will be much greater than that, all right? We have done 6 studies so far with pre-calving supplementation, and all of them paid off, at least broke even. We haven't seen a scenario yet that it actually causes a big loss. I do not know yet what's the best amount of supplement, what is the best supplement, and the duration. We're still working on it, right? But I also put a lot of some description of the studies that we're doing this year, and so you guys have an idea of other studies that we're working on. One of them is that since we know now that we have to supplement those animals for the entire late gestation, the last 12 weeks, what can I do to make it cheaper? So this study is looking at frequency. So instead of providing supplementation every single day for the whole 12 weeks, we're providing supplementation either 3 times a week, Monday, Wednesday, or Friday, or once a week, just on Monday, right? And then another treatment that doesn't get anything. So we're trying to identify how low can we get in terms of frequency of supplementation before affecting the mother, before affecting the calf. Where is the point that we can actually reduce labor without sacrificing performance? Okay? Is that clear, everybody? This is the most important data. We also send those animals to the feedlot, and we actually see that the ones that were born from cows that receive supplementation, they have better response to the vaccination. More calves respond to the vaccine. It's hard to add a dollar number to that value because vaccine is almost like insurance, right? You invest in insurance, and if you don't need it, it feels like you wasted money. But if you invested on vaccine and you actually get them exposed to the disease, and less calves become sick because of that, then it's a lot of value to this, right? Think about this feedlot producer that doesn't have to treat a lot of those calves during the receiving period. And we also saw that carcass quality was improved. So our animals in this environment with our Boscinicus influence, they also respond very similar to the other studies that we're looking in other parts of the United States. All right? So once I have all the data, I will be able to do more in-depth economical analysis for somebody selling the calves at the time of weaning and somebody selling the calf, retaining ownership all the way to the slaughter. And then I can tell you if all those strategies work or not. All right? Does anybody have any questions before we move to the next section? Sorry if I went too fast, but I wanted to go straight to the point of the main findings that we had. And there are more details about this study in the proceeding. You guys can read it when you get home at your convenience. Also, I would like to remind you that all of the studies that we do, if you go online on YouTube, on our page, all of the videos are there recorded. And you can watch it, all of the studies that we have done. Okay, so if you want to know more details about other studies that we did or about this one, just go online and there will be a video there, really easy and convenient for you. Okay? Any questions before we move? All right. Thank you very much.